Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again, both for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com. We're glad that you all could be with us. Also, joining us are our friends at iHeartRadio and Amazon Music Podcast. We're glad you all could be with us as well. This is part of our News You Can Use segment here at WYAD. As we're heading into a new year, for those who are dealing with presbyopia or age-related blurry near vision, there's now a new option to help you manage this condition. It's called Vuity. It's a first-of-its-kind, once-daily prescription eye drop to treat presbyopia, and you can be able to get it now. Now, to find out if you guys are right for this, we're excited to welcome two great guests to our program. We have Dr. Selina McGee joining us, as well as Toni Wright, who was a Vuity clinical trial patient. We're going to talk to the two of them not only about Vuity, but also presbyopia, let you guys know where you can get more information, and also hear part of Toni's experience as well. Dr. McGee, Toni, thank you so much for the time. Really appreciate it.
Thank you, Sarah, for having us.
Well, really excited about this. Dr. McGee, I want to start with you. Talk to us more about this condition. For those who are just now hearing about this age-related blurry near vision, what exactly are the signs and symptoms of it?
So presbyopia, as you said, is age-related blurry near vision. So think about those instances where you have trouble seeing small print, and it is worse in dim light. So if you have brighter lights, that can sometimes help you read. If your phone has become a struggle and you have to blow up your text, that's another symptom. Squinting to see things up close, those are all symptoms of age-related blurry near vision, which we call presbyopia.
So since it is something that is so common then, Dr. McGee, do you have any recommendations for our audience for those who are experiencing those symptoms?
So I love that you ask, and this is what we're here to talk about today. We are making history. So historically, we have relied on reading glasses, contact lenses, prescription eyeglasses to help us when we need to see small things. But we are launching, and I'm excited to share, Vuity is the first and only FDA-approved eye drop to treat age-related blurry near vision, or what we call presbyopia. So for the first time in history, we're going to be able to help patients and people be less reliant on their reading glasses. They're going to be able to utilize an eye drop called Vuity.
So, Toni, I want to bring you into the conversation. It's a great time to be able to mention, as I said, you were part of the clinical trial. What inspired you to become a part of this?
So I obviously had blurry near vision, and I used readers, and my doctor, I met the criteria, so my doctor asked me if I wanted to participate, and I thought, what a great thing to have an eye drop to be able to correct your vision or to correct the blurry near vision.
And so for you, since you were a part of the clinical trials, and Toni, what has been the experience for you in dealing with Vuity?
Well, during the clinical trial, of course, I didn't know at the time that I was using Vuity, and nor did my doctor, but when I would use the drops in the morning, my vision would improve throughout the day where I would not need to rely on readers throughout the day.
So this is really exciting, Dr. McGee, for those who are dealing with this. I know when I was prepping for this segment, a lot of us didn't even probably know there was a name for it. But to know that there is something that can be able to help with this age-related blurry near vision is exciting. So kind of walk us through the steps here. How does this new eye drop work, Dr. McGee, and how can our listeners find out if it's right for them?
Excellent. So with presbyopia, the way that Vuity works is it actually makes your pupil smaller. So it kind of mimics being in bright light. So that's why you see better when you're in bright light, is because your pupil is smaller. So Vuity makes your pupil smaller, thereby giving you better near vision. And the best way to find out about it, of course, is to talk to your eye care provider. And you can also visit Vuity.com, and I'll spell it out for our listeners, VUITY.com. There's more information there. And if you don't have an established eye care provider, you can also find someone in your area that's close to you that can prescribe the drop for you, because it is a prescription medication.
Gotcha. Great information, again, for those who are dealing with this. Again, for those who are dealing with presbyopia, you now have a solution to be able to look at that being Vuity. As you heard Dr. McGee mention, the first of its kind, once daily prescription eye drop that can help you treat your condition. Again, Dr. Selina McGee and also Toni Wright, thank you so much for the time today. Really appreciate you stopping by and looking forward to speaking with the two of you again.
Awesome. Thanks, Cyrus.
Thank you.
Hey, thank you. And we thank your audience for tuning in to another great segment of Conversations Live, part of our News You Can Use segment here at WYAD 94.1 FM and WYADonline.com. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.